Hello, good evening. My name is Dr. Chudi Ufondu of Snowspirations Global Health Solutions. I hope you're having a wonderful weekend. This day, it's very important to our community because we have a very important topic to talk about. Today, we're going to talk about endometriosis, a very debilitating gynecological condition some women might currently be going through. Now, it's important you understand what endometriosis is. It's important to understand the severity of your own endometriosis. And it's important to understand what you need to do to improve your fertility. So please, once you join this afternoon's clinic, just do us a favor by introducing yourself and tell us where you're located. My name is Dr. Chudi Ufondu. I'm going to drive the conversation this afternoon, and we're going to spend approximately 20 minutes. So I'm going to use the first 10 minutes to bring you up to speed about endometriosis. Then afterwards, I will open the clinic. You will have opportunity to ask your questions. If today is the first day you are attending this clinic, I'm so glad you found time to attend. Please make sure you subscribe appropriately. Please make sure your notifications are set to inform you when my clinics will come forth. I normally run 2 clinics on YouTube, one on Tuesdays, 6:30 p.m. Eastern Time US, 11:30 p.m. Nigerian. Then on weekends like today, 3:30 p.m. Eastern Time US, 8:30 p.m. Nigerian. So thank you so much and welcome to today's discussion. So today we're talking about endometriosis. Endometriosis. It's important to understand that this condition can affect your fertility. Before we begin the conversation about the endometriosis, let's talk about the endometrium. So this is the female reproductive system, well structured, well designed to function appropriately to help every woman of childbearing age to become pregnant monthly. So the way God structured the body of a woman is supposed to be pregnant monthly if everything goes okay. The most important place I want you to lay emphasis on, it's in the cover of your womb. The cover of your womb is called the endometrium. Now, this is where the problem starts. So the endometrium changes over time, depending on where you are in your cycle, depending on if pregnancy happened. Now, if pregnancy happened, pregnancy will normally happen in the tubes, in a special place called the ampulla. Then they will start developing in the endometrium. For the pregnancy to develop appropriately in the endometrium must be thick enough. Endometrium is under the control of 2 important hormones, estrogen and progesterone. So the endometrium will grow up to a particular thickness that will support pregnancy. This is how normal pregnancy will go. Now, if pregnancy doesn't happen and everything is all back to normal, the cover of the endometrium, the top layer of the endometrium will shed off. This is what happens in your monthly bleeding. When this happens, you will start all over again. However, in endometriosis, the cells, which ordinarily should be limited only in the cover of the womb, the normal place we are expected to have endometrial cells, it's on the cover of the womb, nowhere else. But in endometriosis, for some reasons, we will see deposits of endometrium in other places which are not the cover of your womb. And when that happens, it begins to give a lot of problems. It's important to understand that endometriosis is one of the most painful gynecological conditions out there. It's a very painful condition. So when the inner lining of your womb, which is called the endometrium, it's seen elsewhere, and when you normally bleed, when pregnancy fails, those cells there will start bleeding. For example, if we have endometrial cells in the ovaries, they will affect the function of the ovaries. The ovaries will no longer be able to perform its role of releasing the eggs. Now, the occurrence of endometrial cells in the ovaries is called endometrioma. That's a special type of endometriosis of the ovaries. When this happens, it will affect the function of the ovaries. The problem with endometriosis is the fact that Since those cells are not in the cover of your womb, when your monthly bleeding starts, they will not find an avenue for the bleeding to go away. What will happen? For example, if we consider the endometriosis of the ovaries, the blood will be collecting in the ovaries. They will not find a way to leave the ovaries. They will stay there and they will start causing problems. They will start causing inflammation. They will start causing adhesions, and they will ultimately damage the structures of the ovaries. And when that happens, you will no longer ovulate. And when you don't ovulate, pregnancy will not happen. So the major problem in endometriosis is the effect it will have on those structures in any place it's found. If we have endometrial cells in the tubes, they will also damage the function of the tubes. And when that happens, the tubes will no longer support pregnancy. So the major impact of endometriosis is dependent on the location and the severity where endometriosis happens. So it's important you understand this. Your regular menstrual cycle will happen based on the nature, based on the outcome of pregnancy or not. If pregnancy happens, progesterone and estrogen will keep nurturing the embryo until you go through first trimester, second trimester, and third trimester, you have your baby. If pregnancy fails, the cover of your womb, which is called the endometrium, which was getting ready for pregnancy to start developing, will disintegrate. The disintegration of the upper layer of your endometrium is what you will pass out when you bleed monthly. Now, what are the major symptoms of endometriosis? This is something you need to be very careful with. The first one is severe pain. I don't think any time in gynecological discussion we've seen anything equivalent to the pain women that have endometriosis will have, because anytime you have any collection of blood in your body, if that blood is not leaving your body, it will cause a lot of problems. So number one sign and symptoms of endometriosis is what? Severe pain. Now, also women that have this might have increased bleeding. So instead of bleeding normally, the normal flow that your pad and your tampon can take care of, you will notice an increase in the quantity, the heaviness of your bleeding. That can also be a presentation of endometriosis. Some women will notice pain when they want to do number one. So when you want to urinate, you notice pain. When you want to make love, you notice pain. When you want to defecate, you notice pain, depending on where we have those endometrial cells. So some women might have classical gastrointestinal endometriosis. It means we have a lot of endometrial cells just about the area of your bowels. So when you want to open your bowels, you feel a lot of pain when you want to do number two. When you want to urinate, you feel a lot of pain. When your period is coming, you're feeling very severe pain. And when you want to make love, you feel very severe pain. And ultimately, the reason why we're gathered here today is because ultimately it will cause infertility. So women that have endometriosis, depending on the severity of your endometriosis, will not be able to become pregnant. So if you have severe endometriosis, you definitely need fertility management for you to be able to become pregnant. If you have moderately classified endometriosis, maybe you won't even know and you can still become pregnant. And if you have mild endometriosis, it might not even be diagnosed and you can still become pregnant. So what's the management protocol? What can we do to help women that have endometriosis? Unfortunately, it's not curable. So it's not one of those conditions we'll give you a magic drugs and completely your endometriosis will go. It's not curable. It's a condition we have to manage for life. Now, the management is dependent on the severity. There are hallmarks, there are basic standards in treating endometriosis. The first one is pain management. Because it's a condition that will cause excruciating pain, we'll definitely have to manage pain. So in managing pain, we'll give you a lot of what? Painkillers, strong painkillers. Painkillers like non-steroidal anti-inflammatory drugs, like your ibuprofen, like your Felvin, like all those strong drugs to manage the pain. Now, we also use hormonal drugs, especially oral contraceptive pills to manage this. This is an area we need to be careful. Because guess what? Women that have endometriosis want to have babies. And one of the ways we can manage endometriosis is to use oral contraceptive pills. So how can you be giving a woman that want to have a baby oral contraceptive pills? So they are both contradictory. But we still have to do this. So the number one management of endometriosis is painkillers, strong, controlled painkillers. So depending on your pain threshold, paracetamol might be okay, ibuprofen might be okay, and if it doesn't work, we can step up to injections, we can step up to IV, so you can get relief. Because if you don't get relief, we're not going to talk about making babies. So we definitely use ibuprofen, naproxen, Felvin, and all that. We can use that, but we can also use oral contraceptives. When we are using oral contraceptives, we're going to use it for a short period of time. And once we are sure we have regularized your hormone, we are going to give you ovulation induction drugs. However, if your case is severe, if your case is not responsive to oral contraceptives and pain management, then you might have a need to go for surgery. So for surgery purposes, we have to identify all those abnormal endometrial cells and we remove them. So the more we can open them up and remove them, the more we're going to improve your fertility. I will give you one classical example of endometriosis that can be nasty. There are some women that will notice during their bleeding, they bleed from their navel, their belly button. The reason why they are bleeding from their belly button is because they have some endometrial deposits in the belly button. Now, what happens for you to bleed from the belly button? When your period will normally come, instead of majority of them to be leaving from the vagina, some of them will be exuding from your belly button. That's a type of endometriosis of the umbilical area. In that conditions, if you're having infertility based on secondary or primary, we need to operate on you. So the stepwise approach of managing endometriosis to improve your fertility is what? Number one, pain management. Number two, hormonal management with oral contraceptive pills. Number three, ovulation induction drugs and a couple of other hormone-related drugs to balance your hormone, because the overall aim of it is to improve your chances of ovulating. Then ultimately, if they fail, then we go for surgery. So surgery is the last button. Now, if we are not successful in any of this, and if your endometriosis is extensive and is causing you a lot of pain and it has completely damaged your structure, the most important approach of endometriosis that will offer you a permanent solution is hysterectomy. Unfortunately, in women that want to have babies, once we go for hysterectomy, you no longer have womb. So you cannot have a baby if you don't have a womb. Now, in that situation, can you still start your family? Yes. What will you need? Surrogacy. So if a woman has some good eggs, but unfortunately she has extensive problems with her womb and endometriosis, what are we going to do? We are going to use her eggs, but we are going to find another woman that will carry her baby for her. So surrogacy is an option for couples that have severe endometriosis. So we're going to remove your womb through the process of endometriosis and through the process of hysterectomy. Then we look for another woman that will carry your baby. That's an option. So whatever your severity is, whatever your individual endometriosis situation is, your management will be tailored for you. There are some women that will have mild endometriosis. The painkillers will take care of the pain. There are some women who might need combination of the painkillers and the oral contraceptive pills, and they will have relief. There are some women who will use pain management, hormonal management, and surgical management, and we can still improve your possibility of becoming pregnant. But you need to understand this. Once we have diagnosed endometriosis, it's a condition you will manage until you go. It doesn't have a permanent cure. So the overall aim is to inhibit the growth of the tissues and prevent them from reoccurring. Once we can do this, then you can manage and you can have quality of life. And of course, it's not good to be on drugs for a long time. Like whenever you're on painkillers, it can put a lot of pressure. It can damage your kidneys, it can damage your liver, and you can begin to develop liver problems and kidney failure. We don't want that to be used. So we manage it conservatively. So we would not personally advise you to be taking painkillers every day. It doesn't make sense. Maybe you can only be taking it when your period comes. So this is my presentation on endometriosis. And at this juncture, I'm going to open the clinic so you can have an opportunity to ask your questions. So please, if you have any questions, go ahead and start asking your questions. Admin, please, you can generate 2 questions each. We have just 6 minutes. Once we are done with this clinic, we're going to have a repeat clinic on Facebook for 20 minutes. Then we can adjourn for today. Remember the big event coming up on the 29th, our masterclass. Our masterclass for October is going to be a combined masterclass, combined fertility and pregnancy masterclass. You do not want to miss this event. Admin, please go ahead and ask your questions so I can provide you feedbacks. If you have questions, please feel free to ask questions. I can see Angela from Lagos. I can see COO, then I can see Chinyere. So COO, please ask me 2 questions. Chinyere, ask me 2 questions. And Angela, if you have questions, please ask. You guys have just 5 minutes. And let me see, sometimes we will normally have problems with the question popping up. So let me see if I can call up some questions from my phone. Sometimes we have that problem. So hold on. And COO, please, if you have any question you asked that I didn't see, you can put it on our common discussion thread and I can use it to provide you feedbacks. Okay, here we go. Is endometriosis diagnosed once a woman starts her menses? So it's a clinical diagnosis. It's not a diagnosis we will just, have without tying some clinical evidence. So what do I mean by that? If you notice, the symptoms are mentioned. You can have pain, you can have painful intercourse, you can have painful urination, and it can be anything. It can be urinary tract infections, it can be sexually transmitted infections, it can be PID. So diagnosing endometriosis is a situation we have to tie a lot of things together. We have to examine you, we have to ask you a lot of questions, and of course, we have to go for some investigations. So diagnosis is based on your presentation. And of course, if you want to have a baby, and you're having infertility, we have to take you through all the infertility assessment. So we have to look at your hormones, we have to look inside your womb, we have to look at your tubes, we have to look at your ovaries. So based on the clinical presentation, we can now make a diagnosis. And based on the severity, we can now manage you if it's mild, if it's moderate, and if it's severe. I love that question. Are there lifestyle changes that can help with endometriosis? Yes. This is one of the best questions I've received regarding endometriosis. Of course, when you improve your lifestyle, when you watch what you eat, when you eat more fruits and vegetables, when you don't consume a lot of highly calorific food, when you control your body weight, when you avoid stress, when you avoid alcohol, when you avoid smoking, they will help to ameliorate the likely symptoms you can have from endometriosis. Now, we don't know for sure the exact cause of endometriosis. We know some predisposing factors. So if you can eat properly, eat your fruits, eat your vegetables, eat your whole grains, drink only water, avoid smoking, avoid alcohol, then watch your body weight. Then naturally you can prevent yourself from developing all these gynecological problems. So lifestyle modification is still going to be basic. And thankfully, the lifestyle modifications you're going to have will overall improve your fertility. So if you eat properly, if you drink only water, if you don't smoke, if you don't drink alcohol, by default, you're also improving your fertility. So generally, healthy lifestyle will also improve your possibility of managing endometriosis or preventing it entirely. Okay? Now, how does endometriosis affect fertility? Very, very important question. So remember, ordinarily, we are not supposed to have endometrial cells elsewhere in the body. So if we have these endometrial cells in the ovaries, that particular type of endometriosis in the ovaries is called endometrioma. So it will distort the architecture. It will disrupt the environment of the ovaries. So the ovaries will no longer be able to perform its role. So what's the function of the ovaries? The ovaries will prime one egg every month, which will develop into dominant follicles, and it will burst open to the process of ovulation. So when you have endometriosis of the ovaries, they will form some endometrial focus, they're called endometrioma, damaging the architecture, damaging the environment of the ovaries, and the ovaries will no longer be able to perform its role. And you will ultimately have some adhesions, and in course of doing that, you can also have some hormonal imbalance. Now, if you have endometrial cells in the tubes, it's going to lead to adhesions. It's going to damage your tubes. And when your tubes are not open, then naturally pregnancy will not happen that way. So it depends on the extent, and it depends on the location of the endometrial cells. If endometrial cells is located in any of the reproductive organs, it will affect the function of that particular organ. That's how it can lead to infertility. Is the uterus the point of trigger for endometriosis cells? No. Remember, the womb is actually the original site for your endometrial cells. The original place we should have endometrial cells, it's in the endometrium. We are not supposed to have endometrial cells elsewhere. So if we find these endometrial cells elsewhere, it begins to have problems. Okay, so yes, you're wondering, since you mentioned that he's correct. Correct. So the reason, when we remove your womb, the focal point for all those triggers will end. So yes, the primary source of the endometrial cells we can see elsewhere. So picture endometriosis as a form of ectopic endometrium. So if we find the endometrial cells in the ovaries, in the tubes, inside the muscle of the womb. So the type of endometriosis you find inside the muscle of the womb is called adenomyosis. So the focal point, the original site, the primary site of your endometriosis is actually the womb. So that's why when we remove the womb, we solve the problem permanently. I love that question from Chinyere. Very, very, very technical question. Correct. Is weight gain a symptom of endometriosis? No. But weight gain can complicate your endometriosis. If you lose weight, you can ameliorate the symptoms. So weight gain or weight loss is not a direct symptom or presentation of endometriosis. How can one manage the mental health issue, depression that may... Okay, no, so here's the deal. Pain is a terrible thing. You see, pain sucks. So psychologically, mentally, there are some type of pain you will have. You even think of taking your life. True statement. And imagine telling a woman that want to have a baby, they're going to remove her womb. Of course, psychologically, you're going to be depressed. You're going to have anxiety problems. So you definitely need to modify your way of approach of life. You definitely need to seek counseling, professional counseling. So we definitely need to take care of some of your symptoms. So if we can take care of your pain, if you can take care of all those pains you will have, then you would have removed some of the symptoms that will make your mental health to be poor. And of course, if you modify your lifestyle, so regardless of what you want to do in life, if you eat appropriately, if you drink water, if you exercise, no matter the symptoms you have, if you find time to exercise, you're going to release endorphins. And when you release endorphins, endorphins are going to make you feel good. And when you feel good, you're going to improve your mental health. So generally, exercise is huge in managing your mental health. The type of food you eat, it's important. Counseling, direct talking therapy, it helps. So your mental health is very important. Of course, looking at life from positive spectrum, because some women that have this condition will feel, oh, since I have this, I'm suffering from pain and I still can't have a baby. Remember, the bottom line is to have a baby, right? So imagine a woman that has severe endometriosis and we're telling her we're going to remove her womb. So imagine a woman that want to have a baby. We're telling her we're going to remove her womb and she's still having that pain and she doesn't have a baby. So we have to look at alternatives. Of course, ultimately, this woman might be a candidate for IVF, depending on her own state of mind. So mental health is very important. I love the fact that you asked this question, especially October is Global Mental Health Month. So be very careful how you indulge in what you do on a daily basis. Some of your gynecological problems can trigger your mental health problems, leading you to depression, leading you to anxiety, leading you to even suicidal tendencies. So be in charge, seek professional help. For example, if you are told you have endometriosis, not a condition you sit back and you'll be managing yourself. You definitely need the care of a specialist, fertility specialist, an endocrinologist, and of course, your gynecologist. So we have to determine what will work best for you. So it's not a condition you stay back and you'll be doing things by yourself and you're hoping to become pregnant. It's a condition that can lead to infertility. So you need professional guide. You need to be attending master classes. You need to modify your lifestyle so you can also give yourself a better chance of having good outcome. Okay, there's another question. Is it true that surgery can lead to endometriosis because it's common? Correct. So any surgical procedure you've done might be a focal point. So for example, in course of going for evacuation, in course of going for CS, we can unexpectedly, carelessly, accidentally transfer some endometrial cells elsewhere. So it's called iatrogenic cause of endometriosis. So anytime you're opening the body of a woman, we can inadvertently, mistakenly transfer some endometrial cells elsewhere. So yes, so that particular question you asked is very powerful question. And yes, surgery can be a form of spread of endometrial cells elsewhere. So yes. Do we have any other question? I love all these questions. They are very technically and clinically based. So the bottom line is this. If you are told you have endometriosis, you can feel bad, you can do all that, but once you're done doing all those emotional things, seek help. You have to retain the services of a fertility specialist. We must classify your type of endometriosis. We must start treating your symptoms. We must manage your pain. Definitely, we have to balance your hormone. And if need be, you have to go for surgery, we go for surgery. And if need be, you have to go for assisted reproductive technique, you go for that. But it's not a condition you can manage by yourself. You definitely have to get the help you need. All right, guys, thank you so much for coming. I genuinely enjoyed this particular class. I want you to join me in our Facebook conversation in just 5 minutes. So join us on the main page. We're still going to talk about this topic. And if you didn't get your feedbacks, you're going to have an opportunity. Remember to keep a date with us on the 29th. Masterclass, combined masterclass on infertility and pregnancy. So until I see you guys, thank you for coming and enjoy the rest of your evening. And God bless you and bye-bye for now.